Anxiety disorder, symptoms, causes, and treatment. Introduction. According to medics and various researchers, anxiety leads to fear and worries about what is about to occur. Occurrences such as a child's first day to school, going for a job interview, and giving a speech before people may make other people nervous and fearful. Scholars also believe that anxiety is a normal way the human body responds to stress. The anxious feeling can be termed as an anxiety disorder when it lasts for an extended period of more than 6 months while causing interference with an individual's life. In the cases where anxiety has turned out to be a disorder, the nervousness and the feeling of fear may stay with an individual most of the time and become intense and devastating. Main body. This feeling may force an individual to stop doing things they like or enjoy doing, and if left unchecked and treated, the disorder may progress worse. Anxiety disorder can affect anyone at any age, and it is the most common form of emotional disorder. According to the American Psychiatric Association, women are more highly affected by the disorder than their male counterparts. The most commonly known anxiety disorder is post-traumatic stress disorder. Other types of anxiety disorder may also include phobia and social anxiety disorder, such as panic and separation anxiety disorder. The feeling of anxiety differs from person to person, and it can come in the form of nightmares, panic attacks, and painful thoughts or memories that someone can fail to control, depending on the person. Some of the common symptoms of an anxiety disorder include an amplified heart rate, hasty breathing, nervousness, paying attention, and insomnia. This paper aims to explore anxiety symptoms, causes of anxiety, and available treatments for anxiety. What causes the anxiety is not well known as the researchers are not aware of the exact cause. However, they suggest that anxiety is likely caused by the amalgamation of factors, including brain chemistry, environmental factors, and genetic factors. The researchers also suggest that the part of the human brain regulating anxiety may be affected by anxiety disorders. Diagnosis of anxiety requires some tests, as a single test may not be used for diagnosis. The diagnosis of anxiety disorder involves a lengthy process that includes a physical checkup and psychological health assessments through questionnaires. Some medical service providers go an extent further to test or examine the blood and urine of an individual to help rule out the underlying medical conditions that might contribute to the symptoms the patient experiences. After diagnosis, the treatment process may begin, and the patient may explore available treatment options with the doctor. The treatment for anxiety is subdivided into psychotherapy and medication. For some patients, medication may not be prescribed by the doctor, and thus, they are required to change their lifestyle, which may help them cope with their current condition. In moderate or severe anxiety cases, the doctor may prescribe medication and another form of treatment to help the patient overcome the symptoms and lead a manageable day-to-day life. Antidepressants and sedatives are some of the medications prescribed by doctors to help in treating anxiety. These drugs aid in balancing the brain chemistry and also operate by preventing episodes of anxiety and preventing the most severe anxiety symptoms. The natural remedies that can be used for anxiety include lifestyle changes. This is an effective method that individuals can use to relieve stress and anxious feelings they may encounter in their daily lives. The individuals may also naturally prevent anxiety by participating in healthy activities and eliminating unhealthy activities. For instance, an individual may choose to get enough sleep, meditate, and exercise to prevent anxiety. Conclusion. In conclusion, this topic of study was chosen because of its importance in the ongoing global pandemic, which has made people anxious and depressed. I have realized an existing relationship between anxiety disorder and depression through the study. Depression is currently one of the most challenging mental health disorders, especially during this global pandemic. Depression and anxiety sometimes occur together, thus, a patient suffering from an anxiety disorder is likely to be depressed, though both states can also occur separately. Anxiety can be considered a major clinical symptom of depression, as the worsening symptoms of depression may be caused by the anxiety disorder. I have learned that people need to understand that anxiety can affect all people, from children to older people, and be treated. There are available options for anxiety treatment, including psychotherapy, medication, or a combination of psychotherapy and medication. I have also learned that most people with mild anxiety symptoms always assume their conditions and do not consider treatment or seek medical advice as an option but choose to live with the condition. In my opinion, people need to know that anxiety can be treated even in the most severe cases. Thus, there is a need for individuals suffering from anxiety disorder to seek medical treatment.